It's pretty wild when you think about it. One of the very first uses for the kind of therapy we're talking about today was, well, literally for guys building tunnels underwater.
Right, they were getting decompression sickness, the bends.
Exactly, the bends. And the solution back then, stick them in a pressurized room. Now fast forward, and that same core idea is being used for, well, a whole bunch of surprising medical conditions.
It's fascinating, isn't it, how you trace that almost basic application through to what's now a really sophisticated medical treatment.
Yeah, it really shows how observation and maybe a bit of necessity can lead to big things.
Totally.
And that brings us right to the main topic for this deep dive, hyperbaric oxygen therapy, or you'll hear the experts call it HbO2.
HbO2, right.
Yeah.
That's the official abbreviation from the UHMS, the Undersea and Hyperbaric Medical Society.
So we're going to unpack what that actually means, the science behind it, and look at some of the ways it's used, all drawing from this really detailed textbook, Hyperbaric Medicine Practice.
And this isn't some brand new idea. This book's been around since 1994, updated several times, now in its fourth edition from 2017.
Wow, okay.
Yeah. And having the UHMS involved really underlines that it's based on solid scientific study. They're serious about doing this properly. So yeah, HbO2 is the term we'll stick with.
Got it. So our goal today really is to give you a clear picture of hyperbaric medicine from this source. We want to go beyond just, breathing more oxygen and get into the practical side.
But without making your head spin with too much jargon.
Exactly. So let's start right at the beginning. What is hyperbaric oxygen therapy, basically?
Okay, so in simple terms, it's breathing 100% pure oxygen while you're inside a special chamber where the air pressure is increased, usually quite a bit higher than normal.
Higher than just sea level pressure.
Right. Think of it like dissolving gas in a fizzy drink. Under pressure, you can dissolve more gas into the liquid. Here, the liquid is your blood plasma, and the gas is oxygen. Much more oxygen gets into your system than just breathing normally.
And the book actually shows these chambers. There are different kinds, right? Like on the cover photos.
That's right. You've got what they call monoplace chambers. Mono meaning one, so just for one person. They look a bit like a clear tube almost.
Okay.
And then there are multiplace chambers. These are bigger rooms, basically, that can hold several patients, and sometimes medical staff can even go inside with them. Chapter 5 goes into all the details about how those work.
So you're in there, pressurized, breathing pure O2. What's the effect? What's happening physiologically?
Well, Chapter 2 covers this in depth, but the key thing is that the increased pressure forces way more oxygen into your tissues than usual. It's like flooding your body, your cells, with oxygen.
A superdose.
Sort of, yeah. It gives your cells the fuel they need to function better, to heal. And this basic effect has implications for lots of different medical problems. But the history of how we figured this out is, well, it's quite a story.
It really seems like it. And one name that keeps coming up, especially in the earlier editions of the textbook, is Eric Kinwall. His story's pretty linked to diving, isn't it?
Absolutely. The preface talks about his own diving experiences, but also his work way back with those caisson workers. These were the guys digging tunnels, often under rivers, in places like Milwaukee.
The ones getting the bends.
Exactly. And he wasn't just treading them. He was, collecting data, figuring out safer ways for them to come back up to normal pressure. He was a real pioneer. The book calls him one of the founding fathers of what became the UHMS.
And it sounds like the whole field has matured a lot since those early days. More scientific now.
Oh, definitely. The foreword makes a point about this shift.
Yeah.
Moving away from just, anecdotal stories, this worked for this person, towards really solid evidence. Proper studies, meta-analyses. It's much more evidence-based medicine now.
Which is good, obviously. But I also saw a note of concern in the foreword about maybe the focus becoming a bit too narrow sometimes.
Yes, exactly. Because hyperbaric therapy has become so important for treating, say, chronic wounds, especially diabetic foot ulcers, there's a worry that some clinics might only focus on that.
Right. And miss the bigger picture.
Potentially.
Yeah.
They might not be as familiar with the whole range of other conditions where HbO2 is proven to help. So resources like this book covering the full scope are really vital for keeping practitioners up to speed on everything.
Okay, that makes sense. So let's talk about some of those other conditions then. Section 2 of the book lists the approved uses, and it's quite a list. Maybe start with carbon monoxide poisoning. That seems like a big one.
It is. Chapter 13 covers it. Carbon monoxide, it's nasty because it basically grabs onto your red blood cells much tighter than oxygen can. So your blood can't carry oxygen properly.
Right. It hijacks the system.
Pretty much. HbO2 works because the high pressure in pure oxygen helps push that CO off the hemoglobin and floods your plasma with dissolved oxygen, keeping tissues alive. It's often a critical, time-sensitive treatment.
Okay. Then there was one I found really interesting. Chapter 14, idiopathic sudden sensorineural hearing loss. Sudden hearing loss.
Yeah, idiopathic just means they don't really know the exact cause. But for sudden, unexplained deafness, HbO2 is actually an accepted treatment. The idea is that boosting oxygen delivery to the inner ear, those delicate structures, might help them recover.
Huh. Okay. Less common, but accepted.
Exactly.
What about gas embolism, chapter 15? That sounds like something pressure would definitely affect.
It does. A gas embolism is basically a gas bubble blocking a blood vessel. Divers can get this, but it can happen in other medical situations too. The increased pressure in the hyperbaric chamber literally shrinks the bubble.
Physically squashes it.
Yeah, based on physics principles, Boyle's law. It reduces the bubble size and helps the gas dissolve back into the blood faster, hopefully restoring blood flow before permanent damage occurs.
Right. Okay. Then there's a whole section on infections, chapter 16 through 19. Gas gangrene, other serious tissue infections, even brain abscesses. How does oxygen help fight bacteria?
It works in a few ways. For gas gangrene, specifically, Chapter 17 explains that the bacteria causing it hate oxygen. They're anaerobes. So high oxygen levels are actually toxic to them.
Kills them directly.
Yes, but for other infections, as Chapter 16 outlines, the high oxygen levels can also sort of supercharge your own immune system, help your white blood cells work better, and even improve how well certain antibiotics get into the infected tissue.
Fascinating. Okay, what about chapter 20? Chronic refractory osteomyelitis. That sounds nasty, like a bone infection that won't quit.
That's exactly what it is. Really stubborn bone infections that standard treatments haven't cleared. HbO2 can be a game changer here. It helps stimulate the growth of new, tiny blood vessels, capillaries, into the infected bone.
Ah, so it improves blood supply to the bone.
Precisely. Better blood supply means more oxygen gets there naturally, and it also helps antibiotics penetrate the infection site better. It creates a better environment for healing.
Makes sense. And then, of course, diabetic foot ulcers, chapters 21 to 23. You mentioned this is a huge area now.
It really is. These ulcers can be devastating, often leading to amputation. HbO2 is used as an adjunct therapy, meaning alongside other treatments. It boosts oxygen to the wound, which is often poorly supplied in diabetics, encourages new blood vessel growth again, and helps control infection. The book stresses it's part of a bigger plan, though.
Right. Not a magic bullet on its own.
Not usually, no. It's part of a comprehensive strategy.
Okay. Chapter 26 mentions crush injuries and acute traumatic ischemias, like when tissue suddenly loses blood supply.
Exactly. Think of a severe accident. The limb gets crushed. The tissue is starved of oxygen immediately. That's ischemia. HbO2 floods the area with oxygen dissolved in the plasma, even if blood flow through vessels is compromised. This can help keep tissue alive, reduce swelling, and buy time for healing or surgery.
Wow. Okay, here's one I definitely wouldn't have guessed. Chapter 27, exceptional blood loss anemia.
Yeah, this is less common but vital. Imagine someone's lost a massive amount of blood, and maybe a transfusion isn't possible right away, perhaps for religious reasons or availability. HbO2 can maximize the oxygen carried by the plasma and the remaining red blood cells. It acts as a temporary bridge, essentially keeping vital organs oxygenated until the anemia can be addressed properly.
That's incredible. And chapter 28, skin grafts and flaps. How does it help there?
Well, when surgeons move skin or tissue, like in reconstructive surgery, that tissue needs to develop a new blood supply quickly to survive.
Right, it needs to take.
Exactly. HbO2 improves oxygenation in that fragile tissue and encourages those new blood vessels to grow in, increasing the chances of the graft or flap surviving.
Okay. And then radiation injury, chapters 29 and 30. This is for damage caused by cancer treatment.
Yes, specifically delayed radiation injury. Sometimes problems crop up months or years after radiation therapy. The radiation damages small blood vessels. HbO2 helps by, again, promoting newer blood vessel growth in those damaged tissues. This can improve circulation and healing and alleviate long-term side effects. Chapter 30 looks specifically at gynecologic cancer radiation injuries.
What about thermal burns? Chapter 31.
For severe burns, HbO2 can be an added therapy. It helps reduce swelling, gets more oxygen to the damaged skin, which might help it survive, and could potentially speed up healing and help fight infection in the burn wounds.
And the last one on the approved list here, chapter 32, central retinal artery occlusion, an eye problem.
Yes, it's basically a stroke in the eye. The main artery supplying the retina gets blocked. It causes sudden vision loss. If HVO2 is started very quickly, the idea is to force oxygen into the retina to keep it alive while doctors try to restore blood flow. Time is absolutely critical here.
Wow, that is quite a range of approved uses. But like any treatment, it's not risk-free, right?
Yeah.
Chapters 9 and 10 talk about downsides.
Absolutely essential point. Chapter 9 discusses contraindications, situations where HBO2 shouldn't be used.
Yeah.
And Chapter 10 covers potential side effects. The most common issue is ear pain or problems from the pressure changes, similar to flying or diving.
Like needing to pop your ears.
Exactly. More serious things, like oxygen toxicity affecting the lungs or central nervous system, are possible but rare when protocols are followed correctly. Careful patient screening is key.
And Chapter 7 brought up something I hadn't thought of, how drugs might act differently under pressure.
That's a really important consideration for practitioners. The pressure and high oxygen can actually change how some drugs are absorbed or metabolized. So Chapter 7 gives guidance on that.
And Chapter 11 talks specifically about using HBO2 in kids, because, children aren't just small adults.
Right. Okay, so that covers the established uses. But Section 3 looks beyond that, at off-label and investigational stuff.
Yeah, this is where research is ongoing. Things that aren't standard approved treatments yet, but where there's interest or preliminary evidence. Chapter 33 gives an overview.
What kind of things are we talking about?
Well, the book mentions exploring it for conditions like a vascular necrosis of the hip, where bone tissue dies due to lack of blood supply. Also for really difficult fungal infections, even for brown recluse spider bites, which can cause nasty tissue damage. Spider bites! Wow!
Yeah. Again, these are areas being studied, not standard care yet.
And I saw chapters on traumatic brain injury, TBI, and other neurological issues, and Hansen's disease, which is leprosy.
Yes. Chapters 37 and 38 look into the potential for HBO2 in TBI recovery and maybe some other neurological conditions. Chapter 39 discusses Hansen's disease. These are complex areas, and like the others, it's really important to stress this is investigational. We need more solid proof before they become routine treatments, but the potential is being explored.
Still, it's fascinating to see where the research is heading. Now, Section 4 kind of brings us full circle back to diving.
It really does. You can't understand hyperbaric medicine without understanding its roots in diving. Chapter 40, for instance, is all about managing diving emergencies, like the bends.
That original problem.
Exactly.
But it goes beyond just treating accidents, doesn't it? I saw chapters on submarine rescue, dive medicine in general.
Right. Chapter 42 covers the very specialized area of submarine rescue. Then you have chapters like 43 to 45 dealing with broader dive medicine topics, the physiology of diving with different gear like rebreathers, issues faced by technical divers.
And even ocean exploration, living deep underwater, Chapter 46.
Yeah, the extreme physiology of saturation diving in deep-sea habitats. It all ties back to understanding how the human body reacts to pressure, which is the fundamental principle of HBO2 therapy as well. They really inform each other.
And finally, the book touches on some of the key people, like Harry T. Whelan. His background sounds incredible.
It really is. Professor of neurology, pediatrics, and hyperbaric medicine, a Navy captain involved in undersea medicine and sub-rescue, even research with NASA on light therapies. Quite the resume.
Who definitely adds a human dimension. And of course, Eric Kinwall's foundational work we mentioned earlier.
Absolutely. Kinwall's contributions, as highlighted in the preface, were just immense in establishing the field.
So wrapping this up, we've really covered a lot of ground on hyperbaric oxygen therapy, all based on this textbook. We started with the basics, breathing pure oxygen under pressure.
Yeah, and we saw how that simple concept, born from treating divers with the bends, has evolved.
Hugely. Into a recognized therapy for a whole spectrum of conditions: CO poisoning, tricky infections, non-healing wounds, radiation damage, sudden hearing loss. The list is surprisingly long.
And we also touched on the areas where it's still being investigated, like TBI or neurological conditions, showing that the story isn't finished yet.
Yep.
Plus, understanding that constant link back to diving medicine.
Thinking about all these different applications, from healing tissue right down at the cellular level to potentially helping brain injuries. It really makes you wonder, doesn't it? What else might this therapy be capable of as we learn even more about how our bodies respond to oxygen under pressure?
That is the million-dollar question, isn't it? The interplay between physiology, pressure, and oxygen is so complex. As science digs deeper into those mechanisms, it feels almost inevitable that we'll find other conditions where manipulating that environment carefully could be really beneficial. The potential still feels vast.
If any of this sparked your interest today, maybe a specific condition or the history, we definitely encourage you to look for more information from reliable sources like the UHMS website. Thanks for joining us for this deep dive.